Welcome to our first HD Saturday Brunch webinar. I'm Dr. Stephanie Bissonette, and I'm joined today by genetic counselor Ginger Norris. Together, we direct the VCU HDSA Center of Excellence. Our intention with this series is to provide practical educational topics for the Huntington's disease community in Virginia and to hopefully answer some of the questions you may have about living with HD. Before we get started, I want to go over a few housekeeping items. All participants should automatically be on mute with their cameras off. If you have any questions for today's speaker, please submit them using the Q&A button on the bottom of your screen, and we'll try to address them all live. We plan to host these webinars throughout the year. Our institution is in the process of switching webinar providers, so please sign up to receive emails about the dates and topics, as well as how to access the next meeting. To sign up, please send Ginger Norris at virginia.norris, Norris, at vcuhealth.org, a quick email asking to be signed up for the HD news from our center. Please mark your calendar for our next session of the brunch series, Maintaining Intimacy Between Care Partners, with Amber McCarthy, social worker, coming to us from Houston, Texas, on January 17th, 2026. Today, we are very excited to kick off our series with a great discussion by Allison Bartlett, who is a disability lawyer and the HDSA Manager of Disability Programs. Allison obtained her law degree from the University of Cincinnati and holds a BA from JMU in International Affairs. She is an avid traveler and has studied in Argentina and Switzerland and has worked in England. Her work has been focused in the nonprofit sector for over 10 years on topics such as human rights, domestic violence, and social justice. In her role at the HDSA, she shares her expertise in disability processes to guide people with conditions like Huntington's disease through the very complex process of obtaining Social Security disability. Allison, thank you for being here today, and we are so looking forward to hearing your talk titled Disability: Applying for Social Security Disability.
Yeah. Thank you so much for having me here today. I know this is one of those topics that comes up so much, especially with the HD community, because unfortunately, a lot of people have to stop working. But I'm really happy to talk about this today and to hopefully simplify the process and make it a little bit less scary, because I know this is often overwhelming and we don't want that. Anyone can anyone can manage this. Share my screen. Okay. Hmm. So as Stephanie said, I'm going to be talking about navigating Social Security disability today. So one of the things I like to start with is the Social Security disability application starts long before you actually even start the application. It starts before you even think about the application. And I'll talk more about this throughout the presentation, but one of the big things is you cannot get approved for Social Security or disability of any kind if you do not have a clinical diagnosis of Huntington's disease, if you do not have medical records, and you do not have a support team who's going to help you through this process. This is not something that you can do alone. Before even getting to the point where you start the application, everyone should create an online account. Everyone should create a mysocialsecurity.gov account. It tells you if you're eligible for Social Security disability and how much you would get per month. This 90% of Americans pay into Social Security, so 90% of Americans are going to get Social Security or be eligible for Social Security disability. There are people who, because they were teachers, public employees, state employees, they pay into a separate disability retirement program. Always be aware of what you pay into to make sure you are looking for eligibility for these benefits and that you have everything you need. The next big thing is under Social Security's rules. Social Security does have specific listings or medical criteria for Huntington's disease. It's 11.17. I also really love to tell families and clinicians and social workers to use 12.02 for neurocognitive decline, because in my experience, most families with HD, most individuals with HD are not disabled because of their physical limitations. They're disabled because of their cognitive behavioral limitations that impact their ability to work. And all of this is centered around your ability to work. It's not that you can't do anything in your life. It's that you can no longer work because of your Huntington's disease. And it's not just your past work, but it's any work in the regional or national economy. So it's not just work in Richmond. It's not just work in Charlottesville. It's not just work in Lynchburg or Norfolk. It's anywhere in Virginia. It's anywhere in the entire continental United States. And then I'm going to talk more about compassionate allowance later. And The big thing is you really have to understand your symptoms and limitations when you're going through this process. You have to be very open and honest, and you have to make sure you're being open and honest with your clinicians, like Dr. Bissonette, like like Ginger, and your clinical care team, because if you are not telling them what you are experiencing on a regular basis, they won't know. It won't be in your medical record notes. They cannot recommend additional evaluations like neuropsychiatric testing, swallow testing, just other things that would help you and your disability claim. All of this is trying to make sure you're living your best quality of life. I'm not going to read this. You don't have to read this word for word, but I always put the Social Security Act up here because Social Security is a federal program. So it is governed by the Federal Code of Regulations, which means it is governed by federal law. If you do not follow Social Security's explicit rules and regulations, you will get denied. I'm not going to make you read the Social Security language because it's complicated. I'm going to break that down, but it is part of the federal law legal process. So you need to understand that you can't just waltz into this and think you're going to get approved right off the bat because that's not how it works for anybody. Big one, number one, the burden of proof is on you. And what that means is when you submit a Social Security disability application, it is your job to make sure Social Security has everything that they need to find you disabled. You have to include all of your medical record information. You have to include all the symptoms and limitations you experience from HD. You have to include all of your doctors. You have to include all your past work history. Social Security is not going to go out and like find this. They are required to request medical records, but they can only make decisions on the things that they have been given. Their job is not to go out of their way to prove you're not disabled. The proof you have to prove you are disabled. And that's honestly really difficult for a lot of people. You need to gather all the evidence and submit it with your claim. You need to be a very active participant in the claim process. Submitting the application is honestly just one step of the whole claim process. There's going to be additional forms. You need to do follow-up, which I'll talk more about later. And you need to be able to accurately describe your symptoms and limitations to your clinicians in the application, to friends and family, to anyone who's helping you with this. Because if you undermine your symptoms, if you say, I'm not really that impacted, I'm fine, I can totally work, Social Security is going to deny you because you have opened the door, and we do not want that. Okay, two, this is a big one. Most people do not know this. Social Security disability credits expire. Social Security disability insurance is just like any other kind of insurance. Health insurance, car insurance, life insurance, there's terms, limits, and if you stop paying into the policy, so for disability purposes, if you stop working, your policy will expire. For Social Security disability, usually you have about 5 years once you stop working before your credits expire. So let's say you stop working this year, you've had a very consistent work history, you've worked for the last 15 years. That means your credits will expire in December 31st of 2030. So that's if you stopped working this year. And it's also really relevant and important to point out that Social Security follows up on these credits through your taxes. So you better be filing your taxes or Social Security is not going to know that you're paying into the system. Um, it is important to note that retirement and disability work differently. If you've earned your 40 quarters of credit for retirement, you have retirement, you're set for life. Again, Social Security disability is set on a rolling basis. So the general rule is you have to have worked 5 out of the last 10 years. And again, you need to be filing your taxes, which gets complicated because you don't technically have to file taxes if you make less than $10,000 a year. But if you're making less than $10,000 a year because of your HD symptoms and limitations, you need to be filing for disability. Um, and what this also means is you don't want to wait. One of the myths that I hear regularly is like, oh, don't you have to be out of work for a year before you can apply? That's not the rule. Social Security's rule is you have to have a condition that'll last 12 months or longer. We all know at this time, unfortunately, there is no cure for Huntington's disease. So if you have Huntington's disease, it is not going away. You don't have to wait 12 months to prove that. If you've had to stop working, apply for Social Security as soon as realistically possible. Number three, You need to know what Social Security benefit is right for you. I get this question all the time. There's actually two Social Security programs. There's Social Security Disability Insurance and Supplemental Security Income. They mean different things and provide different benefits. SSDI is the work earnings credits thing I was just talking about. You have to have worked 5 out of the last 10 years, and you have something called your date last insured, which is when your credits expire. That is not in your online account. You'd have to call Social Security and ask for that. But they would be able to give it to you if you wanted that specific information. You would just ask, what is my date last insured? In order to be eligible, you have to either stop working or cut back your work enough that you're earning less than $1,620 per month gross. So that's before taxes are taken out. This number is specific to 2025. Like, likely in the next month, Social Security will release their updates for next year because all of these numbers increase slightly for the cost of living adjustment. So the work limit will be a little bit higher in 2026. The nice thing about SSDI is there is no asset limit. They don't look at your spouse's earnings or income. They don't look at any of the assets or savings that you have. You can be getting pension from an additional program. You could win the lottery, and it will not impact your Social Security disability benefit. With the SSDI program, the max benefit is up to $4,000 a month. The national average is about $1,500 a month. And if you have children under the age of 18, they could get additional supplemental benefits as well, which means if you're getting $1,500 a month as the individual and your children are eligible for $1,000 total, that means your family would be getting $2,500 a month. So it means you'll be getting additional benefits. SSI, on the other hand, is the financial need-based program. There's no work requirements, but there's very strict financial need criteria. As an individual, you can only have $2,000 in assets. This includes checking account, savings account, any retirement accounts, IRA, 401k. If you own a second car, the second car counts as an asset. If you own more than one home, that counts as an asset. Your spouse's income is deemed onto you. So if you're married, it becomes very, very difficult to become eligible for SSI. And the asset limit for a married couple is only $3,000. So you don't count as two people, you only count as 1.5 people, which is very difficult to maintain. The max benefit in 2025 is only $967 a month, which is substantially lower than SSDI. The average, though, is $650 a month because Social Security reduces your payments if you're getting in-kind support. So if you're living rent-free, um, or if you're not paying your fair share of rent or anything like that, then your benefit amount is going to be reduced. And there's no additional benefits, so you don't get additional benefits for your children. Oh, and I forgot to mention this. Each program comes with health insurance. SSDI comes with Medicare. SSI comes with Medicaid. I was thinking before Virginia expanded Medicaid, the Medicaid was not like it wasn't mandatory. You would have to submit additional documentation in the state of Virginia to show that you met their even more severe Medicaid criteria. Virginia has expanded Medicaid. That's not an issue anymore. But those are important considerations to make. It's also really important to know Medicaid will help cover long-term care costs. Medicare does not. Medicare is the insurance that helps cover doctor's visits, it helps cover hospitalizations, um, but it does not, it doesn't cover long-term care. And Medicare does not start immediately if you are approved for SSDI. It comes after getting 24 qualifying payments. And I hate that I have to say that, but the reason is because there's not a 2-year automatic wait period. Let's say once like your application is approved, let's say your disability started um, January 1st of 2024, and it took you until now to get approved for benefits. Like, so it's been almost a year and a half since you started the process. You've finally been approved. You're not going to have to wait 2 years from now to get that approval. Um, you only have to wait 6 more months. And so that's why it's 24 qualifying payments and it's not just 2 years. Like from the very beginning, let's say you stopped work in January of 2025, then like you're not going to get benefits until like June of 2027. It's more based on like the date you stopped working and the date your disability started. For Social Security purposes, the date your disability starts is the day after you've stopped working, as long as you've already been getting medical care. If you stop working and then it takes you another year to get a diagnosis and medical care, then in that case, the date that your disability started would be the date of your diagnosis. These are complex questions. These are things that I'm happy to answer in one-on-one consultations because they're difficult to explain and walk through when doing a presentation like this. But yeah, the big thing I want everyone to take away with Medicaid and Medicare, Medicaid is what covers long-term care costs. And that's the thing a lot of people need help getting, and I can answer additional questions about that. But for now, I'm going to move on. Um, Another question. So I've been talking about disability benefits or Social Security disability benefits expiring. Um, there are things that you can do. So let's say if you've been medically diagnosed with HD for 2 years and then your Social Security disability credits expire, that is a case where you could potentially get your benefits. You could still apply for Social Security. What I've seen happen though in the HD community is someone stops working. They have an inkling that they may have HD. They know there's no cure. They've unfortunately encountered a physician that was not super helpful or, gave dismissive information like there's nothing we can do for you, come back, or like just there's nothing we can do for you, or their families experience that. So they're like, I don't want to go get this diagnosis. What's it going to benefit me for? So they stopped working and they finally get a diagnosis 7 years after they've stopped working. And there is no planet where they're going to get disability or Social Security disability insurance at that point. Because if your diagnosis comes after your credits expire, we can't backdate it. You could be eligible for SSI, but we cannot backdate SSDI benefits. So if you get a diagnosis, then you stop working, and then you wait a few years, there is stuff that we can do. We can work with that. But if you don't get a diagnosis until after your credits have expired, which you wouldn't know unless you've talked to Social Security, like that's really, really difficult to overcome, and it's never been successful. Um, what would you need to show? Sorry, I'm getting lots of questions. Uh, and I want to answer them in real time so it makes sense with what I'm talking about. Um, you don't so the question is, what do I need to show or prove that I've stopped working? You're not working. You have no W-2, you have no recorded income, and so it's pretty easy to show that you stopped working. What's harder to show is the why. But if you have no income coming in, if you haven't had a W-2 for that year, if you don't have any pay stubs, Social Security has that information. It's a good question though. So let's say you file for Social Security disability and you're either working like in a very limited capacity or you just stop working that month, you may have to submit your pay stubs so they can get accurate information as to how much you are making. But it's not a high burden to show that you've like stopped working. They can kind of track your statements. And with some things like with SSI, if you're approved for SSI, you may have to submit proof of your bank statements every month to show that you're less than that $2,000 or $3,000 asset limit. But you don't have to, that's not something that's part of the burden of proof process. You don't have to jump through all these hoops to show that you stopped working. Okay, so number 4, you have to submit medical evidence with your claim. As I said previously, you cannot get approved if you have no medical evidence or no diagnosis. And it can't just be like a positive gene test is not enough for a Social Security disability approval. That doesn't tell Social Security anything. Social Security only cares about your Huntington's disease. Once it starts to impact you, you have symptoms and limitations, and it impacts your ability to work because you were born with Huntington's disease. And it is one of those conditions where you were not disabled your entire life. And so, for Social Security purposes, it only matters once it has started to impact you, you have symptoms and limitations, and it impacts your ability to work. So what this means is your medical record, like you need to start getting medical care. Really, you need to get medical care from a relevant neurologist. Not all neurologists are the same. If you're going to the VCU Center of Excellence, you're seeing a fantastic neurologist. You got a great care team, but there are neurologists who practice sleep medicine. That's not going to help you. You don't want to see a sleep medicine neurologist for Huntington's disease. That's not going to help you. But it's important to recognize that there are many different kinds of neurologists. There are many different kinds of physicians, and they're not all going to help your claim or you get the care that you need equally. Um, your medical records really need to reflect all aspects of your Huntington's disease. So if you have all motor, cognitive, and behavioral symptoms, those need to be reflected in your medical record. And like I've been saying, you need to be honest with your care team. Because there's cases I have seen before with clients where they were super honest with me, they were super honest in the application, but they weren't honest with their physicians. And so Social Security denied their claim because the records didn't match. What was in the application did not match what was in the medical record file, which is reasons why you need to be open and honest with your physicians. I also like to recommend that you get copies of your medical records, and this should be fairly easy. Like you should be able to access these things in your patient portal. Like I don't know exactly what VCU records look like in your patient portal. I don't know if it has all of your clinic visit notes or if it's just your medical history or if you'd need to request additional things, but it can be beneficial to know what's in there so you're aware of how this claim process could go. Because I have seen like so many well-meaning physicians tell their patients, oh, you're definitely disabled, but that's not reflected in their medical record file. That's why you also need to tell your clinicians and your medical record, not your medical record professionals, your clinicians, your physicians that you're going to apply for Social Security disability in advance, because that gives them heads up for ways that they can help. Medical records are often written so your care provider knows what treatment is happening, so insurance pays for those things. Social Security has this whole other set of criteria. I always like to say Social Security requires everything be submitted in Russian. That's not just a different language, it's a different alphabet. So, and doctors aren't given training on this when they're in medical school. They're not in medical school. They're not given training on this in regular life. Like, the first time I feel a physician sees like the Social Security disability stuff, they're like, oh my God, what is this? It's trial by fire. Nobody wants trial by fire. And you especially don't want to go to your doctors after the fact and be like, hey, I applied for Social Security, but I was denied, because then everybody is scrambling to figure out how to help, how to fix it. Sometimes Social Security is just a pain. That happens. Sometimes they just deny stuff for the sake of denying stuff. And you could submit a perfect claim. But there's definitely times because people didn't talk to their physicians first, they didn't get help, they didn't give them like a heads up, it negatively impacted their claim process. The other thing is people assume that their doctors are the ones getting the medical record request. No, 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 no. Ginger, Dr. Bizanet, they're not the ones who are ever seeing these medical record requests. They're going to the centralized medical record processing facility at VCU. Those people who have no idea who you are, they're just filling out a paper record request. And so that's why it can be beneficial to get the records in your own portal, because you can submit stuff to Social Security directly, which can also speed up the claim process. Um, but all of these things highlight why medical records are so important. And the other thing, like if you're going, well, assuming you're going to VCU if you're watching this webinar, who knows? But if um, if you're going and getting the specialized care from a specialized neurologist, those records are going to be given more importance than anything else. Because Social Security does give importance based on the kind of physician you're seeing, based on the kind of medical condition you have. So if you have your neurologist and your primary care physician and you're applying because of Huntington's disease, your neurology records are going to hold more weight than anything in your primary care physician records. So it's more important to make sure your neurologist knows how all of this is going down, what's going to happen. And, they could write a letter of support for your disability claim. Again, this is one of those things where they could recommend additional testing. In an ideal world, I would have every single person with Huntington's disease get neurocognitive testing before applying for Social Security, because it's a gold standard. Social Security recognized that test and it gives a very high level overview of all the areas where someone is struggling. So, like on the face, someone could seem like they're doing pretty well in life, but these tests could show that there are like certain areas, because they test a lot of different areas. Let's just say they test like 50 areas. It could show that you're really struggling in three of them, but those three areas could be really key for how you work or how you could get a different job, which is how Social Security could find you disabled. Everything works together. And it is important to know if you're applying because of Huntington's disease, but you have other medical conditions, list all of the conditions in your application. Social Security has to look at the combination of your impairments. If you have chronic back pain, if you have knee pain, if you have a hip replacement, those are things could be physical reasons why you cannot work. So it can add to your claim and make your claim stronger. If you have, I'm not saying don't go get other conditions, but if you have them, make sure they are included in your application because Social Security has to look at everything. Just got a good question. I stopped working because it was too hard and my health insurance is through my spouse. I'm worried about getting a formal diagnosis because I'm worried about losing my health insurance. Should I get a diagnosis and apply for disability? Your health insurance is protected. Your health insurance is one of the only things that is protected from genetic conditions, from pre-existing conditions. You cannot be denied access to health insurance because you've been diagnosed with Huntington's disease. And this is something I like to talk about a lot too. Like insurance can get expensive as like the disease process progresses because you're going to need additional care. But if you're in the prodromal or pre-symptomatic stage of HD, there's no reason why you should be paying more for health insurance because you may not need any additional care at that point. But it's one of those things that's going to change over time. But being diagnosed with Huntington's disease is not going to disqualify you from health insurance. And especially if it's health insurance through a spouse through work, that's the easiest way to get health insurance. And they have to apply it across the board and give it to every employee and their spouse equally. And that shouldn't increase the cost. But yeah, I am a very big proponent of, I know there isn't a cure for HD at this time, but there are a lot of things that you can do to make sure you have the best quality of life. Seeing the right clinical care team, having the right support systems in place, getting Social Security disability, those are all things that will add to quality of life because there are medications that help with anxiety, depression, things that are common with HD, medications that help with chorea, getting speech therapy, a swallow study to make sure you're eating properly. There are all these things that work together to improve and maintain quality of life, which for me, that's what I'm really passionate about. That is one of my goals. And so all of this stuff is to help make sure you can live the best life for today while we're working on that cure for tomorrow. I know I talked about the genetic testing, like your CAG repeat. One thing I did not mention is participating in clinical trials is fantastic. We need people to participate in clinical trials. It is really important to note, though, if you are participating in a clinical trial, those records, that testing, that cannot be submitted to Social Security because it's like it doesn't exist. Clinical trials are closed trials. Most of the time, your clinician doesn't even know who you are in the clinical trial. And so if you're participating in clinical trial care, you also need to have regular appointments with your neurologist to make sure there are medical records and evidence for your Social Security disability claim. Since I'm doing all the talking, I'm a little thirsty this morning. Um, Huntington's disease qualifies for compassionate allowance. I mentioned this earlier. So compassionate allowance is a special list through Social Security that will help expedite the processing of your claim. It doesn't change anything that you have to submit for HD. It doesn't change that you still have to meet Social Security's criteria and what medical evidence you have to submit. It just helps speed up the process. Um, it is really important to note that Social Security is really bad at flagging claims for compassionate allowance, especially Huntington's disease cases. At best, they only flag them 50% of the time. This is one of those things where once you submit a disability claim, you need to call Social Security within 3 to 5 business days and be like, hey, did you flag my claim for compassionate allowance? I need you to do that if you didn't. As if it's not flagged in the initial stages of the application, you miss the chance where it can get flagged. I'm going to talk about this in a little bit, but everything starts at your local field office. It has to be flagged at your field office because once it gets sent to Disability Determination Services, it's too late to add the flag because at that point it's already been separated into different piles. You don't want it to go into the regular pile because it could take months. Compassionate allowance pile has to be looked at more often. There's not as many cases in it, then that all of that helps to expedite the claim. It's also really important to note that Social Security is alphabetically challenged. Huntington's disease is not listed under letter H. Where do you think it's listed? It's listed under letter A for adult onset Huntington's disease. As you can see in my presentation, I say adult onset Huntington's disease, and that's what you should put in your application. Put all of the keywords, especially if you do an online application, just make sure it's trying to trigger as many things in the system as possible so you get correctly flagged for compassionate allowance. And this is a resource we have on HDSA's website, which is the whole overview of compassionate allowance for Huntington's disease and what language you should use in the application to help make sure it gets flagged. And I put this in every application. Please flag my claim for compassionate allowance for adult onset Huntington's disease per DI 23022.923. That's Social Security's internal code. Because people will fight with you about it. Because Social Security employees are not always the smartest. Also, there's like so many different medical conditions out there. The reality is most of them have not heard of Huntington's disease. Don't be afraid to advocate for yourself because that's a lot of this process. And that's hard. Advocating for yourself is learned. It's not something innate. It's not something we're born with. This is why you should not complete the application alone. This stuff can be difficult and it can be scary. Um, and also, like if you have a care team, more eyes on the application can make sure you put something in that you may have left out. It can make sure you're not making errors. It took me 6 months of doing this full time before my supervisor would let me do an application without being reviewed anymore because there's just that many things that go into it. So it really does help to have a second set of eyes to be like, am I crazy? Did I read this correctly? And I always love to use the analogy. Would you ask a pitcher with a broken wrist to pitch game 7 of the World Series? Absolutely not. So, why are we expecting somebody with a cognitive disease to complete this complex paperwork by themselves? That's not realistic. You don't have to be the one completing the application if you have HD. Social Security has designed it so someone else can very much complete the paperwork for you. And again, it's not just the application. There's going to be additional paperwork. There's going to be follow-up communication from Social Security, and you may even be asked to go to a Social Security doctor's appointment. And it is possible to have a claim be denied because you failed to cooperate. So if you are terrible with mail, you live by yourself and you're getting assistance from a family member, use the family member's address to send all of the application stuff to them. Your permanent address can be listed, but use a separate mailing address if you know you're going to struggle with things like mail, because that can get you denied. Complete the application from the perspective of a bad day. You really need to be brutally honest with a Social Security disability application because Social Security is never going to see you. They're judging you based on pieces of paper. So your medical records, what you put in the application, any supplemental evidence like letters from your physician or friends and family. So you have to paint a really detailed picture. I always ask, would you rather submit a stick figure or a Mona Lisa? You know what? A good Monet totally gets the point across. We all understand his watercolor flowers. So just to the best of your ability, but you really do have to put detailed information in there. Example, um, I have memory loss. That is not enough for Social Security. I have memory loss and it impacted this at my job. I get stressed out while driving now because things that were familiar aren't familiar. I got lost in the grocery store. I forgot my best friend's last name. You have to include examples of what your symptoms are and what limitations they're causing to really make Social Security understand what's going on. And so changes to daily life, changes to hobbies, etc. And one of the resources I have on HDSA's website is a sample question list that has questions about cognitive limitations, behavioral limitations, physical limitations to help you be able to talk about this. Because again, this isn't your job. This isn't your background. Come to me for resources. I know how to navigate you through the process. You've never done this before. Assume Social Security does not understand Huntington's disease because they likely do not. Uh, It's a rare condition. The person has likely never heard of it. And so, in addition to showing that you have HD and that it's disabling, a lot of the times it's also your burden to educate Social Security about what Huntington's disease is, how this could impact you. They could send out incorrect forms. They could assume that it's just a physical condition because HD is still categorized as a movement disorder, but that's leaving out two-thirds of the disease. And so, they could send out paperwork that leaves out that language. Again, this is why you want to talk to your clinical care team in advance to make sure all the relevant stuff's already in your medical records. And it's good to include language like HD is a combination of Parkinson's, Alzheimer's, and ALS. It can be really helpful to use other diseases to help describe HD so they can be like, oh, that makes me understand now. I mean, I've done that on behalf of clients when I'm like, it's like ALS and Parkinson's all rolled together, and they're like, oh, if you get them to make that O sound and have that realization moment, that's really helpful. And I hate that this burden is on families and you have to work harder to do it, but I want to make sure you have this information to give you the best chance of being approved as quickly as possible. Follow up with Social Security. This is a big one because they are not going to follow up with you. Social Security is not going to update you on the status of your claim. If you submit the claim online, you can get a percentage claim update. And I have heard they're trying to update the system to give a little bit more information, but it doesn't tell you if they've got medical records from Dr. Bisonet. It doesn't tell you if they've looked into your work history. It doesn't tell you if something is missing. It is your job to confirm with Social Security that they have that information. I mentioned this earlier. It's also important to understand how the Social Security process works. Everything starts at your local field office in Richmond. It's that lovely office on Carey Street. It's super close to Shindig's. If you love cake, go to Shindig's. Not a fan of the Social Security office. Um, I know that they have long wait times when you try to call too. But everything is based out of that office. Like in Chesterfield, I think you have an office. Like there's regional offices based on zip codes, but your zip code will tell you what office you go through. They start everything. You can only contact your personal field office while your claim is pending because only they have access to your case and your information. But they confirm if you meet the technical criteria and the work credit criteria. Once you've met those criteria, then your claim gets sent to Disability Determination Services. That's a completely separate office and a completely separate part of Virginia that is kept like as secret as possible. When your claim gets transferred to that new office, usually you get forms in the mail called the Adult Function Report and the Work History Report, and it will have the contact information of that office on those forms. Most people overlook them. It's really important to read these forms thoroughly because when you get that Adult Function Report, that's the person that you want to contact. They're going to have access to the medical records. It's Disability Determination Services that sends out the medical record requests, that gets the stuff from your doctors, that make the actual medical determination in your claim. So you want to know who to contact because it's impossible to find that information online. Like Social Security makes it as difficult as possible to find who to contact on purpose. And then number 10, and we've talked about this throughout the presentation, you need to make sure that you advocate for yourself. This is your disability claim and no one else is going to speak for you. I used to tell everyone to have a family or loved one like become an appointed representative. Social Security has now made that incredibly difficult. You have to become an official appointed representative with Social Security through the Baltimore office. That's not how it used to be. And so for most individuals, it's not worth it to become an appointed representative anymore, unfortunately. But in that case, it can be worthwhile to hire an attorney instead. Social Security disability attorneys do not charge an upfront fee. They only get paid if they win your case, and they get paid a portion of your back fee. Pay, fee, whatever. What that means is you never pay the attorney directly. Social Security will pay the attorney part of what they owe, and then they'll give you the rest of your past due benefits. Technically, it was money you never had to begin with. So it's not something you've lost, and it means if you get benefits significantly faster, it is worth having that attorney to navigate you through that process so you don't have to deal with the complexities of talking to Social Security directly because trust me, it is a headache and it definitely made my blood pressure go up when I had to do it every day. Um, so if you can make somebody else do it, it's worth it. Um, but yeah, you ultimately know yourself and your needs best. Arguably speaking, we know Huntington's disease does fun things that cause impairments in insight and awareness and judgment and on big words like anosognosia, which is again why you need to have a care team. If someone in your life has HD and they have limited insight and awareness, they should not touch the application because they will get themselves denied. That is a harsh reality of it. Um, and let's say you do all of this stuff and you get approved for Social Security. Um, when do your benefits start? So the way it works is Social Security always has a 5 month wait period from your disability onset date. The disability onset date is not usually the day most people complete the application. Again, it's that date like when you stopped working and also have a medical diagnosis. So if you stopped working May 31st and your disability started June 1st, then the first month you could get payments is December. And for a lot of people, it takes like anywhere from 8 to 12 months to get a decision. So for most people, they're going to start getting benefit payments right away and even be owed some back pay because the process just takes a long time. This is just a general overview of what to include in the application. Again, always happy to have that conversation. Best practices, don't undermine your symptoms and limitations. Ask for help if you need help. Ask for questions. Go to your clinical care team. Let them know. Get help from them because they are so amazing. I know I could not have done this without the neurologists, without the social workers. Like I needed them just as much as my clients did to get them approved for disability. Um, Make sure you keep an up-to-date list of your medications and definitely track any side effects. Social Security take those really seriously. And again, follow up with Social Security or hire an attorney to follow up for Social Security for you. These are where you can locate a lot of HDSA's wonderful disability resources. And this is how you can get in contact with me. And I'm always happy to work directly with families.
Thank you so much, Allison. That was so much information. Really wonderful. I'm sure people will come back and watch this over and over again. We do have a couple other questions just before we wrap up here. One is, I've heard that everyone gets denied the first time they apply. Is that true?
No, it is not. That is a myth I hate with every fiber of my being. Um, Unfortunately, the denial rate for the initial application is 70%. Part of the reason is because there are plenty of people who get denied for technical reasons. Either they haven't stopped working, they don't have enough work credits, they don't meet the financial criteria. A lot of people also get denied because they don't realize how much work it is that goes into this process. My approval rate when I was representing families was like 95%. So it is definitely a myth. But again, HD is rare, HD is complicated. Making sure you talk to your clinical care team, making sure you do all of the steps, because you really have to do all of the steps to make sure you've given yourself the best chance of getting approved with Social Security. And I said this earlier, there's a human component to Social Security that we cannot account for. We ultimately do not have a say in who is reviewing your case at the end of the day. They could be having a bad day. They could understand nothing about Huntington's disease. They could be feeling pressure from higher ups in their office that, like, you've approved too many cases this month and arbitrarily denied stuff. And when that happens, because it definitely does, again, I had high blood pressure when working directly with Social Security because I saw this happen more often than I would like. You keep fighting. You call an attorney. You call me. We have a conversation. You get out all of your concerns. I'll be part therapist that day. You talk to me about how difficult and horrible this is, about how frustrating Social Security is. You get that out. I give you an attorney referral. I'm like, you are not alone in this. We are going to get you through this. Because if you do get denied, you 100% need to appeal. Most of the time, I would want your denial reason. But if it's because you were medically denied because Social Security said you were not disabled enough, that happens so often to the HD community because there's a 5-step process. One, you have a medical diagnosis. Two, you stopped working. Three, you meet that listing of impairments, so 11.17 or 12.02. For whatever reason, Social Security does not like to approve HD families at step 3. That's an automatic approval. So then you have to show you can't do your past work or any other work in the regional or national economy. Step 5 is where most HD families get denied because it can be very difficult to show you can't do any other work, especially if you haven't talked to your clinician in advance, you haven't been open and honest about your symptoms and limitations, you haven't talked about your limitations in a way that make it clear you couldn't do other work. That's why you can't just say, I have memory loss, I have difficulty concentrating, I get fatigued. Working with me means I will happily do a consultation. We can pull some of these things out so you can talk about them better. Because again, this has not been your job for the last 10 years of your life. You, it, no one expects anybody here to be an expert on this except for me, because this is what my passion is and this is what my job is. So don't think you have to do this alone because you don't. But doing it alone does increase the chance of getting denied, especially at the initial application stage.
And in terms of finding either a disability lawyer or someone to help with an application, do you think the best pathway is to come through you or the HDSA or the Center of Excellence? How would someone start finding someone to help them with this?
So I'm always looking for more attorneys to help. Currently, I have two attorneys in the country that really have a good background in HD and work with HD families across the country. One is in New York, one is in Colorado. That is irrelevant for Social Security disability because it is a federal program. Um, and the entire time I worked at Caring Voice Coalition, which was just centered right here in Mechanicsville, I had one client from the state of Virginia. Everybody else was from across the country. And remember, I said it a 95% approval rating. It's not about where you are, it's about what you know. And with Huntington's disease, you really do want an attorney who understands that it's not just a movement disorder, it is a cognitive behavioral condition, and that is really why someone can't work anymore. How to break that down, how to talk about that, and how to make Social Security understand that's what's going on.
And probably our last question before we wrap up. I've heard that you can only apply 3 times before you can't resubmit. Is there a limit, and is that true?
There, that may sound like actually appealing. There is no limit to the times you can apply for Social Security disability, but there is that date last insured. Your credits will expire. Um, so there's initial application, reconsideration is the first stage of appeal, an administrative law judge hearing, and I very rarely recommend appealing past the administrative law judge hearing stage because your claim will go sit at appeals council for up to a year. They don't usually make an active decision. They may decide the judge messed up, but it still gets sent back to a judge. Then you have to wait for a new hearing. You have to wait for a judge to do whatever it needs to do. Um, I had this happen, but it was work-related stuff. So I had a client who was found disabled. She was working, so appeals counsel like pulled it, reviewed it, sent it back like, "Hey, we need you to do this additional analysis." That worked out for us. But for some families, it can sit there for a long time. The appeals council will say nothing was wrong. Some people go on to federal court. Federal court also only makes a paper decision. And usually, because it's outside of the Social Security system, it's remanded back to a judge. This can take years. Your date last insured could expire in that time. And depending on how progressed you were when this process started, sometimes it's not worth fighting because what Social Security is looking at, they're not looking at now. Let's say 3 years have passed from the date you say your disability started. They're not looking at you now. They're looking at what you looked like 3 years ago. And if there's been a significant decline, it may be in your best interest to start over.
That was going to be my next question was, so in those cases, is it better to just reapply as opposed to appeal?
That was always difficult. Like, I didn't do appeals council stuff. So when I was working at Caring Voice Coalition, I was like, okay, we can either start over and you can still have me do all of this, or I can refer you to somebody who will take this on. And I would always try to have that conversation with families. Okay, like, this is where I think things were wrong. Yeah, I think they're wrong. You are clearly disabled, but this has changed in the 2 years we've been working together. If we do this, we have to pick a new onset date after the date of your hearing, and things look different now. Because HD is progressive, like that can help. Other things that can happen sometimes is a judge will say, okay, we definitely agree you're disabled. We don't think you're disabled all the way back here. Let's change the date. And that's definitely a much better conversation to have with a judge because I don't want people to have to start over there. But it is kind of a tactical thing because just the reality is with the progressive nature of HD, there will come a point where working again is outside of reality. That's not true for every single condition that exists. So it's different conversations. And if an attorney doesn't truly understand HD and is like, yeah, we're going to keep pushing for an appeal, I am always happy to offer a second opinion and connect you with people who can also offer second opinions. Since I don't directly represent anymore, I'm like, hey, this is what I think, but I want you to talk to one of these two people because they could actively represent you and their opinion matters a lot more if they're going to be willing to take the case. I always want families to have as much information as possible to make the right decisions for them.
Great. As you've really clearly outlined, Social Security disability is really complicated. The application process can be really daunting, but it's really helpful to know kind of what you have to prove. I think we often have families and patients who feel like, well, I have this diagnosis of HD or I have an expanded CAG repeat, so I'm going to apply for disability. And I think knowing what you have to prove is a really big part of this conversation. And you outlined it perfectly for us. Thank you so much for your time. I know this will be really helpful for so many people. And I just want to say again, we are doing these quarterly. We will hopefully see everybody in January, where our talk is on intimacy between care partners. Elson, thank you for your expertise. Thank you for what you do. You definitely make my job easier, and I know that people will get a lot of great information and hopefully get their disability approved. So thank you for joining us.
You're very welcome.
Thank you. I'm going to end recording now.